Happy July, everyone. If you're like me, this summer is flying by. And as you know, July is Health Awareness Month. And so this is a perfect time to talk about empowering your health. I'm Michelle Drayton. I'm the Director for Hospice Access in a program called HOPE, which is a hospice outreach patient and provider engagement program addressing, unfortunately, the underutilization of end-of-life services, which we call hospice. Today, I'm here to talk to you about what it means to empower your health, and hopefully we can get this tab working. It's not. Just one moment, just bear with me. Okay. So again, I'm Michelle Drayton. This is Empower Your Health. Okay, so let's talk about what it means to empower your health, to take control of your well-being. I think many of you are probably in the health field or in the service field, or perhaps you're in another industry, but we know that health is everything. It is really the centerpiece of our lives, right? If we don't have our health and our well-being, it slows us down. It prevents us from accomplishing sort of the goals that we wish to accomplish. So it's really, really critical that we take charge of our healthcare, particularly in this very complex environment. And of course, we've just dealt with a pandemic and we're continuing to deal with a pandemic. So I think we all really understand how important our health and well-being is. And in truth, just how vulnerable we can be when it comes to our health. So what do we need to know about health and maintaining health? And I wanted to talk to all of you first about health disparities and differences in health outcomes, because you know, our well-being and our health is not always in our control. And there are differences in health outcomes between different groups. And we're going to talk a little bit about what some of those differences are. But that difference is actually referred to as a health disparity. So health disparities actually equal that there means that there are differences in health outcomes. There may be more diseases or chronic illnesses in one population versus another. And unfortunately, sometimes there are differences in the rate of, you know, how frequently people die based on race or where they live. And there are many, many reasons for these differences in health outcomes among groups. One of those factors is referred to, a group of factors is referred to social determinants of health. That is where we live, work, and play makes a difference in our health outcomes. Not only where we live, work, and play makes a difference, but of course, how we empower our own health, how we treat ourselves on a daily basis makes a tremendous difference in our health outcomes. So, but not everything is in our control, right? So sometimes we can't control all the time where we live based on our economic situation. And so if we don't have places like parks or a healthy environment that could help to promote our health, sometimes that places us at more risk. Take the situation in Flint, Michigan, right? Where the lead poisoning of the water, people were drinking that water. They didn't know that the lead was not being addressed in the water source. And so many of the children ended up getting lead poisoning and having really that affect how they developed. So that's a social determinant of health. That's an environmental factor. And then there's the economics, right? How much we get paid, how much money we're making. Can we go to the gym? Are we living in a neighborhood that has a lot of really great resources like quality food? Can I just take a walk in the park? Is there a place? Are there enough doctors or healthcare providers in my community? These are all referred to as social determinants of health. Some of those things we have control over, and others we do not. And as a consequence of that, it often leads to differences in health outcomes, but also disparities, gaps, and differences in the rate of disease and how it affects us and in terms of our longevity and what diseases that we get. But there are ways that we can take control. And that's really what I want to talk to you about today. Whether you're a healthcare professional, we need to be taking care of ourselves. Whether you're a caretaker, we need to take care of others. And as service providers, if you're a service provider, we're often in the position of caring and taking care of others. And so we need to understand how where we live, work, and play impacts us and impacts the communities that we serve. But there are also ways that we can empower our own health. July is Health Awareness Month, and one of the most important ways of empowering our well-being is to have knowledge and to have information. So that's what we're going to be talking about today. I hope that you're ready for a great conversation and presentation. Again, I encourage everyone to, ask questions, start the dialogue, use the chat, okay? Here we go. So what health disparities exist, okay? And oftentimes, there are racial disparities, racial differences in the rate of disease or illness, if you will, and even death between races. And it's often not only affected by the communities that we live in, but as I said before, access to health care. Do we have a doctor? Do we have health insurance? So there are known differences in how often certain populations get diseases than others. For instance, Black women in New York City are more likely to die from breast cancer than any other population. And that's oftentimes because perhaps there's not the screening. I hope that all of you who are women and men are going to, get your annual breast screening. That is a mammogram, right? And that you also engage in breast examinations. There's some really, really good videos out there to teach you how to examine your own breast on a monthly basis and to detect whether or not there are any changes. So that's really, really key because unfortunately, Black women are dying at a higher rate than other women of what could really be prevented. And it may not only be because we're not going for screenings, but it also may be related to diet, nutrition. These are all critical factors that we need to be empowering ourselves to do every single day so that we can be strong and that we can be healthy and we can accomplish not only our individual goals, but what our collective goals are for ourselves and our community and our profession. Another disparity that exists is that Black men and women are more likely than others to die from colorectal cancer. And we all know that we should be going to get our colonoscopies, right? If we're under 50, we should be getting a colonoscopy every year. It's not painful. It's a little bit of a task, right? You've got to drink the stuff. You got to make sure that you haven't, eaten the day before. But those screenings are available. And if your doctor is not recommending that you get that screening, or your healthcare professional, you're dealing with a nurse practitioner. I have a lot of nurse practitioners as my healthcare provider. I strongly encourage everyone to get their colonoscopy, because this is a preventable sort of disease. You may have a cancer that's detected, but if it's detected early, it can be removed, right? And so that does not have to advance into, another stage of cancer where we have to get, even more intense treatment for it. Another disparity that exists: Black, Latino, or Hispanic women are more likely to be diagnosed with cervical cancer. I hope that everyone is going to get their GYN examinations. That's gynecological examinations, specifically geared for women, for females, and that we're getting that pap smear, right? So that's really, really important. The other variable, and we talked a little bit about this, that another social determinant of health relates to what our economic situation is, right? How much we're earning every year. Do we have health insurance? Are we living in a community where we have access to providers? And so unfortunately, death rates from probably many preventable diseases are most likely 30% higher in the poorest neighborhoods of New York City as compared to wealthier neighborhoods. Okay, so again, social determinants of health. Where you live, work, and play makes a difference. But that does not mean that if we're living in poorer neighborhoods that we're just going to be in a situation where we're unhealthy. That means that we need to be more aware, more proactive, and more vigilant in making sure that we're getting our screenings for breast, for colorectal, cervical, and for you men out there, remembering to get your screening for prostate cancer, okay? Because that's another disparity faced by many men of color, that they have higher rates of death from prostate disease because they're not going to get that prostate exam. The other difference in health outcomes relates to just premature death, whether it's from gun violence and other situations. Hispanic, Asian, and Black New Yorkers are more likely to die prematurely than whites, regardless of neighborhood income, so regardless of our economic wealth. So what's happening there? Why is that? A lot of it has to do with stress. A lot of it has to do with not going to get the screenings and being treated earlier for things like cancer. And of course, heart disease is still the #1 killer in America in general. So making sure that we're keeping healthy. So first thing is, knowledge is power. And when we have that information, we can be proactive. We got to take the time. I know that we just came off of a pandemic, COVID-19. That was another health disparity that you all know, that many people of color ended up dying at higher rates from COVID-19. One is because of the social determinants of health, but also oftentimes the sort of jobs that we were in. We were not able to work remotely. We were still out in the community, still doing the work, but unfortunately that put us at increased risk. So we know just from this pandemic, which was devastating, and that we still need to be really, really alert about, that we know that there could be differences in how one community is affected versus another. So this was the evidence that I think really should convince everyone that we need to be on top of our health and our well-being. So what do we do to get healthier? Okay. So let's talk about some of the things that we could actually do to maintain healthy habits. First is building a healthy body and a healthy mind, right? So exercise is critical. Okay. If you're not into going to the gym, if you're not into aerobicise or weightlifting, stretching, yoga, simply walking, which helps to calm the mind, reduce stress, is such an easy way for us to get our blood flowing and to stay limber and to really practice mindfulness. That is taking that time out that we all need to rest our minds. And I know sometimes that's super difficult, right? Because we're all so loaded with many, many things that we have to do, many, many different responsibilities. And sometimes it's difficult to take 5 to 10 minutes out to just rest. Simply inhaling and exhaling is a way for us to rest and to reduce stress. And if you come from communities of color, I really, really hope that you hear what I'm saying about the importance of being so even more vigilant about your well-being and about your health, that we need to be taking time to take care of ourselves. Another big factor is eating healthy foods. That's not always easy. I had myself a big vanilla ice cream cone yesterday because I have a 5-year-old. And so, it was wonderful, but I knew that, that probably was about 400 calories, and I needed to be mindful about what I ate for dinner. So it's not like you have to remove all of the great tasting foods, those chocolates, an occasional bag of chips or whatever your favorite food is, your favorite sort of bad food is. But we need to be able to moderate and to manage our diets and eat in smaller portions, right? So if we combine healthy eating habits, high fiber, lean meats, proteins, getting that vitamin in, I take a vitamin every day, and coupled with walking for 30 minutes, or if you're into aerobicise and yoga and doing all of those things, that is going to add so much to our quality of life and to our well-being and to our minds. Our mindset is so important. And the other thing that we need to be mindful of and to do and to be proactive about, and I don't care if you have a huge house or if you have a 500 square foot studio, making sure that our home is safe, comfortable, and clean, and that we're really creating an environment where we can retreat to. And I know that's not always easy. It's not always easy for ourselves. It's not always easy for the people that we serve, for our families, but we have to be able to create that safe space for us. Okay? Get a hobby. Make sure that you're getting your sleep 6 to 7 hours. I'll tell you a personal story. I had the wonderful opportunity to finally spend time with my family during the 4th of July weekend. And I found out my sister only sleeps 3 to 4 hours a night. And I was really worried. And, I knew I had to step lightly because, she's pretty, let's just say, firm about her lifestyle and thinks that this is just perfectly fine. She's been doing this all her life. She said to me, she said, as a teenager, this is the amount of sleep that I need. And I was like, you have to get sleep. You have to let your mind rest. We have to be able to reboot. This is critically important. The number of hours that we sleep, okay? If you're having trouble sleeping, okay, think about why you might be having trouble sleeping. Perhaps exercise before bedtime. That could get the juices going and help you to relax. Do some yoga, do some stretching, okay? Please, another step to empowering our own health is making sure that we prevent disease. Listen to your body. Don't wait to go to the doctor to find out that there's a problem. Listen to your body, whether it is your psychological well-being or your physical well-being. If you feel something changing, if you feel more fatigued, I'm tired, I don't have the energy, I can't concentrate. These are all like signs that we need to be paying closer attention. And so please make sure that you're getting your screenings, that you're picking up the phone to the right doctor. And we're going to be talking about that, finding the right physician, the right provider to go to and get an examination. Okay. And let's make sure that we are measuring our blood pressure. We're making sure that we know what our blood sugar is. Really critically important for women, that we pay close attention to cardiovascular disease, just as men. Oftentimes women exhibit different symptoms than men. We may not have the chest pain, but it may be other symptoms like nausea, or perhaps it's pain in the arm, shortness of breath. Pay attention to your well-being, empower your health. Your annual screenings, okay, your flu shots, your immunizations, your checkups. For women, older women, please, 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 critical piece. You may relate to this. You know, you have a great, sort of relationship with your mom. You know, you're going over there, or your dad. They're pretty healthy, but then they fall. Right. And oftentimes that is the one domino that you need to end up having all of the other dominoes sort of follow suit and fall. And suddenly they go from good health to bad health. So really being very mindful about not falling, about creating a safe space within your home. It's another factor that, you can ensure that you're avoiding falls. And if you're caring for a loved one, making sure that they avoid falls, wear the proper footwear, do the proper things so that we're not falling. I'm not suggesting that we should be afraid to run, to jump, to do all those things, but be careful, okay? And really controlling stress and anxiety is so critically important. So we have a question, and good day to you, anonymous attendee. So next. Okay, the other thing, it's hot. It's 90 degrees. We've been getting a lot of rain, but don't, sleep on it. It is still really hot. We have to maintain good hydration. You know what I like to do in the morning? Water is so amazing. 90% of our body is comprised of water. And so making sure that I am always hydrated. Okay. And so what I do is, instead of having that first cup of coffee in the morning, I have a small bottle of water. Okay. So that I can start. And for me, I instantly feel like revival. I feel like my cells are waking up. We need to be thinking about, not only are we, feeding sort of just our body, but we're really feeding our cells, right, to sort of function maximally. And so really also avoiding overly sweetened drinks. Now, many of you are probably not going to like what I have to say about this. If you drink soda, I would say cut that in half. Because soda really is, I think, one of the major contributors of not only people being, getting too overweight or not being able to control your diet, but also diabetes and other things. So if you drink soda, please, think about drinking other things. And then set goals to what you want to achieve. Everybody talks about, the post-COVID weight and the fact that they've been home and eating things and they've gained significant weight. So think about goals and set those goals, and whether or not it's because you're going off to an event, or you want to be able to go to the beach and wear that favorite bathing suit. Think about setting goals. But the most important thing is longevity, right? Let me tell you a little story about the blue zones. I don't know if anybody knows about this. I love the study of the blue zones. There are many countries from Okinawa to Italy, Sardinia, Italy, to other places in the world where people live long into their centenarian lives. And there are many, many variables that, or many factors, many things that contribute to why they live so long and so healthy. One of which is diet, another is exercise, and another thing is setting goals and having networks, having support systems. And I know that's not always easy. If you live in New York or you live in other bigger cities, oftentimes, we tend to sort of, go to work, go home, and it becomes sort of a pattern. But really try to develop your networks, your social support systems. It's really important, not only for, our joy, our need to connect as human beings, but also it does relate to being healthy. So I'd like to hear from all of you. What are some other ways to maintain healthy habits? What are you doing to maintain healthy habits? Okay. In addition to, making sure that you go to that healthcare visit or taking that walk, avoiding substance abuse. Oh my goodness, this is, a topic all in of itself, right? The impact of substance abuse in our communities, and particularly poor communities. It's tearing families apart, it's tearing whole communities apart. And so, drinking, excessive drinking, obviously abusing substances has a tremendous effect on our health and our well-being and our longevity. But I want to hear from you. What are you doing? I see people are adding to the chats. That's great. At least I know that people are actually here. People talk about meditating. So important. I'd love to hear, how do you meditate? Do you meditate for 20 minutes? Kimberly said that she got rid of sugar. Good for you, and processed food. And she has so much more energy. Go, Kimberly. And Irvaline says she plays gospel music. I love that. I've been playing a lot of music. It's something that I grew up with. And it makes me happy. And I love to dance. Veronica likes to do yoga. These are the things. Pass this on to people. Let's create a network, an Empower Your Health network, so that we could extend this to other people. Thank you guys for weighing in on that. And please, I hope that people are not getting rid of smoking. And to tell you the truth, it's so expensive. It's incredibly expensive. I think a pack of cigarettes is what, $20 or something. It's insane. Other people are weighing in. Deanna, Empower Your Health Network. Liza eats only at home. Really smart, Liza. That is not necessarily a New York or an American thing. We love to go to those restaurants. And you're right, because you don't know what people, how people are preparing their food and what really they're putting in. So I think, maybe decreasing the number of times that we go out to restaurants is a really good idea. Excellent, excellent recommendations. Let's continue this. Let's continue the conversation. So let's talk about one of the number one problems that many of us face, even when we're insured, right, is finding that right healthcare provider. What should we be looking for when we're looking for a healthcare provider? The first thing is, even before the patient-centered care and that the person is looking at the whole body, is that you have a good relationship with them. You can talk to that person. You have time, you're not being rushed, right? That there's the same healthcare provider, you're not seeing 5 other people. I will tell you, I just called up my doctor and I'm changing him. And I have to tell you, I'm disappointed. I called. I saw this doctor probably about maybe just short of a year ago. Spoke to the assistant, had to have many different connections, through a system before, and did not even talk to her, but had to send a message. And finally, she did get back to me. And she promised me she was going to get back to me. That was 3 days ago. Haven't heard anything. And you know what I said? I said, okay, I'm changing my physician. And I hear this over and over again, the lack of a consistent healthcare provider, doctors and nurse practitioners who are not patient-centered enough, that are not really looking at the whole self. You know, you come in with a problem, and that's the only thing that they're looking at. You really want to get a physician or a healthcare provider who treats you holistically, who's a good listener. They have a care management sort of style. That is, they're not only looking at that one problem, but if you're identifying a number of problems, they have a mechanism in place to refer you to other services. And that they also allow you to give feedback, right? And that it should be easy. It should not be, sort of like, this difficult thing to navigate. Also, that care is timely. I felt like my doctor was not timely. I'm leaving. I'm a healthcare professional, and I really do expect, professional courtesies, and that they're accessible and available, and that they're also focused on preventing and screening, as I said, good follow-up system, and quality emphasis. What are you looking for? Tell me, do you have a good physician, a good doctor, a good internist, a good GYN? What's your experience? Oh, Melissa says she's looking for a good bedside manner. Really, really important. And that goes to good communicator. They're interested in you. They're taking some time out. These are the good signs. Being a healthcare practitioner is science and art, right? It's science, art, and social, right? Because you need to have all of those things to really be a really good practitioner. And it's not enough just to be an expert in one area, but can you be holistic? In my opinion, that's really the key to a great practitioner. So the other thing that we also don't think about a lot is making sure that we have um, a healthcare proxy as number one, as part of an advance directive. Maybe, I don't know if many of you know what an advanced medical directive is, but an advanced medical directive, was really critical in this COVID-19 pandemic, right? Many people ended up in the hospital. They were not allowed to bring, their family members, because, of course, we were restricting the number of people who could come into a hospital to sort of, control transmission and not put people at risk. So sometimes they ended up in the hospital, but they didn't have an advanced medical directive. That is, that if they're unable to speak for themselves because they were that sick, no one knew what they wanted, because if you didn't have this advanced medical directive, people are not, your practitioner is not going to know what you want, just in case you get into a situation where they may have to make decisions about advanced medical interventions. And so the first thing I would say, as even a healthy person, you should have a healthcare proxy. Who do you trust? Is it your spouse? Is it your sister? Is it your mom? Is it a friend? To honor your medical wishes, just in case you're not able to express what you want, just in case you get into a situation. I'm not trying to scare people. I'm trying to empower you to make sure that there's someone that knows, I don't want to be put on an event, or maybe I do want to be put in one event. I want everything to be done for me, or maybe I don't want everything to be done for me, depending upon the medical situation. So think about that. Very, very important for you to have at least start with a healthcare proxy. Very, very simple, a simple form. You can go right on to Google healthcare proxy form. Make sure that if you have a physician or a healthcare provider, they know who they can go to and who they can consult with, just in case you're in a situation that you're unable to do so for yourself. Know your patient rights. Very, very important that you know that everything should be confidential. There are actual laws. It's a HIPAA law, and that centers around ensuring that your medical information is kept confidential. And under HIPAA, your medical records and anything you say to your physician or your medical provider must be kept private. And so you could feel confident about talking about any issue, whether it's, a psychological issue, maybe you're experiencing the blues, maybe you have some depression, you're not feeling well. Please know that under the HIPAA, regulations and laws, your practitioner, your healthcare provider must keep that private. What's informed consent? Anytime your provider wants you to undergo a procedure or a test or a treatment, you must give permission, and you have the right to refuse any treatment. So you must give consent. That's really super important. And people need to know that you should also, if you have doubts, you can go seek another opinion from another practitioner. And information about your condition, your healthcare provider should keep you updated about your conditions. You shouldn't be waiting to hear about a test. That's another sign that maybe you don't have the right practitioner, or any treatments and chances of recovery. As I said earlier, I'm in the field of hospice, which is really, obviously one of the most critical times in a patient's life. They're facing extensive disease and terminal illness. And so, this is really, really important that patients need to be kept aware of what their disease is and what their options are. So please know that it is really your physician's, your healthcare provider's responsibility to keep you abreast of what's going on, keep you up to date. And then, as I said, they're the ones that you should be having a discussion with about, advanced directives. And you should say, when you go to your next doctor's appointment, I want you to say, you know what, I have a healthcare proxy. If there's anything that happens to me, I'd like you to talk to my husband. I'd like you to talk to my girlfriend, to my sister, to my brother, whomever that person is that you trust. I want you to share that with your doctor or your healthcare practitioner. So how many of you actually have a healthcare proxy? Put it in the chat. How, yes or no? How many of you actually have a healthcare proxy? Okay, I see some people responding. So my primary care doctor remembers personal information of my interests, even though I see her twice a year. She remembers everything and makes me feel comfortable. That's wonderful. But please, I'm not sure who this is, but please make sure you also have a healthcare proxy. That's really important, someone that you trust. Kimberly shared, thank you, Kimberly, for being honest, said that she does not have a healthcare proxy. Really important, regardless of what age you are. Please make sure that you identify someone that you can trust, that has your back. So I'm going to stop the share right now and take questions about what I've shared with you today. And Deanne told me that she has no healthcare proxy. I am really encouraging everyone to have a healthcare proxy. Please today get out and do some exercise, some stretching, some walking, some mindfulness, and let's talk more about creating that Empower Your Health network. So I am going to pass this back to one of our facilitators, Melissa, and see if we have any questions. Melissa?
Hi, good afternoon, everyone. Thank you for joining us today. And thank you, Michelle, for that wonderful presentation. Just a reminder for all that We have these monthly presentations on different topics for the community, and all of the upcoming presentations are listed on our community collaborations webpage. So I'm going to actually drop the link again in the chat, and we welcome you to join and sign up for some of the other upcoming presentations. Also check out the community collaborations webpage to just learn more information about what BNSNY has to offer the community. And if you are interested in having a presentation made to your community group, or if you have a network, please reach out to us. We'd be more than willing to have someone come out and present. And at the end of this presentation, please I encourage you to fill out the survey, because we welcome the feedback. And again, Michelle, thank you, and thank you everyone for your time today.
Thank you, and have a great day, everyone. Be healthy, be well, take a proactive role in your well-being, and let's create other blue zones right here in New York City, and plan to have a long life that's healthy and well. So long. Bye-bye.